Testosterone is a fat-soluble or lipophilic compound that generally cannot be absorbed if you just swallow it. However, thanks to advancements in tablet technology, we have developed an oral form of native or bioidentical testosterone that actually can be absorbed by swallowing it as a pill. So contrary to popular notion, it is safe on liver markers. We monitor your liver markers because it's absorbed through a different route in the body. It's perfectly safe to do so. It works very well as long as you consume it with about 30 grams of fat with a meal. It kind of piggybacks off of that fat absorption and gets absorbed through the body that way. It lasts about 4 to 6 hours. Take it about 1 to 3 times a day, as I mentioned, typically with meals, and you get the elevated testosterone levels. One of the advantages of oral testosterone is it's less suppressive than other forms, less suppressive than topical testosterone and especially injectable testosterone. And so a lot of patients find that with a very low dose of enclomiphene, or sometimes they don't even need to take enclomiphene at all, it can maintain their natural testicular function and fertility.